India is experiencing heat waves. The continuous rise in temperature has made it difficult for people.
Heat exhaustion, you'll excessive sweating, excessive loss of water from your body.
Now, what precautionary measures, especially people who are exposed to direct sunlight, should take during summers?
During summers, as everyone knows, you have to wear the hat, sunglasses, you don't expose your skin directly to sun, so you will be chances of having skin rashes as well. You have to drink lots of water and try to avoid going to the particular, if it is possible, the peak hours between 12 to 4 hours you should avoid to going or doing. If you can delay your work or you can postpone your work. And one more thing, you just see the weather forecast as well. If you are expecting it's going to be extreme hot, you should avoid, you can avoid it. And wearing the light clothes, summering very light and loose clothes. And the first cloth is if you ask some patients as well, they said I'm wearing the cotton clothes, but the first contact clothing is that also should be the cotton and the light colors, so that we cannot absorb lots of heat and we can feel cool and calm.
Ma'am, now when we talk about diet, what kind of diet should one follow during summers?
Diet, if it is very important in the summer you should avoid fatty food. And you should not take heavy meals as well, like you are eating one time and like skipping your lunch or dinner and take one meal. That also you should avoid it. You take a small and frequent meal. Hydration is very important. So whatever the drinks you are taking it, either you are taking the Nibu Pani, lemon water, cucumber water, or anything, whatever the thing is, light things, you should continue taking it. And one more thing that you should avoid, caffeine products, alcohol. And one more thing that you should avoid is the sugary drink. What I have come to across the patients, their mother are saying, Mama, I'm giving the Glucon-D, ORS, Nariyal Pani, excessive. If you are giving the excessive glucon water or sugary content, that will lead to more dehydration. Okay. If excess sugar in your body, then you'll feel more thirsty, you will drink more water and you will go to more urinate. So concentration of excessive sugar is also very avoidable, and alcohol intake also you should avoid it during the time.
So these cold drinks that
what we are having, it's not good. Just once is fine. But if you ask the patient, they feel very weakness just because of the tiredness. They're taking Glucon-D, sugary drinking, energy drinking. That has to be absolutely avoided. Instead of that, you should take a lemon water, you should take charge, you can take coconut water, you can fresh juices, you can have it.
Ma'am, there are people with diabetes, hypertension, cholesterol. Because of lifestyle, obviously people have increased. The number of people suffering from NCDs has increased. Now, how does heat or change in temperature impact their body, impact people with these diseases?
These diseases, like especially in the diabetes, I would suggest those they are not exposed to excessive heat or sunlight, because the dehydration causes their sugar level increase. When their sugar level increase, they feel more thirsty, dehydrated, they will go more urinate, so their kidney functions and the diabetes level will be increasing. So for those patient diabetes, because their sweating problem is also there, because they are unable to sweat a lot, so they cannot dissipate the heat as well. So their body system is already impaired, so they have to hydrate themselves, keep their sugar level low, avoid sugary drink, avoid exposure to excessive heat.
Ma'am, people with cholesterol, high cholesterol
also with the hypertension and the cholesterol, when there is excessive heat, what happens is your pulse rate, your vasodilation is there, so your pulse rate is very high. So if you are hypertensive, your pulse rate and the medicine you are taking, you should take care of it. Sometimes you dehydration, your blood pressure goes low, so you have to, if you are taking a high blood pressure medicine, you should be cautious about it. You check your blood pressure. If it is very low due to dehydration, you should not take the medicine, or you have to regulate your blood pressure, and accordingly you should titrate your doses and consult your doctor as well.
Are there particular tests that especially workers outside exposed to direct sunlight should take, or people who are working out in the sun should take?
Not for as a preventive measure, but if the patient is exposed to or having the symptoms, they definitely should go for some particular test, like you should do your kidney function test, so you know that your electrolytes level is there, like sodium and potassium level, we should know. And those who are having a urine symptoms, frequency or less urination or burning or itching, they should go for urine routine microscopic and culture test. And one more thing, Ritika, I would like to say, when you are exposed to excessive heat and stress and doing excessive exercise as well, that leads to break down your protein, and that leads to damage your kidney, and it goes into your bloodstream as well. That condition, we call it rhabdomyolysis. So protein is breaking down, so that how do you know that the protein is there in your body or not? So we do the kidney function test and the special tests as well as the creatine kinase test. We should get it done, so we'll come to know whether our body protein breakdown is there or not in your body. So you can take the extra measures in your condition.
Thank you so much, ma'am, for joining us, and I'm sure people who are listening to you, they will know the measures to take during summers. Stay safe, stay indoors, and prevent themselves from direct exposure to sunlight. Thank you.
Thank you, Ritika.